Hello, my name is Rachel Osborne, and I have designed a program for the Dental Health Initiative and Promotion for sealants on adolescent permanent molars. I have named my program Smiles in Need Deserve Sealants Indeed. Healthy People 2020 has an Oral Health Initiative section and subsection OH 12.3, which is to increase the proportion of adolescents aged 13 to 15 years who've received dental sealants on one or more of their permanent molar teeth. The target population is 21.9%. Baseline information is that 19.9% of adolescents aged 13 to 15 received dental sealants on one or more of their first permanent molars and one or more of second permanent molars through the year 1999 to 2004. We would like to see a 10% improvement. Data sources are the National Health and Nutrition Examination Survey, as well as the CDC and NCHS. Data disparities include sex, race and ethnicity, as well as income. Dental decay is the most prevalent chronic disease amongst adults as well as children. However, this is a very preventable disease. Currently, 59% of adolescents aged 12 to 19 have carious lesions in their permanent teeth. If left untreated, carious lesions can cause pain and infection as well as problems in eating, speaking, and learning. The CDC reports that providing school-based sealant programs to the nearly 7 million students who need them could save up to $300 million in dental restorative work for these families. I propose going to Title I high schools to implement a school-based sealant program for students aged 13 to 15. Title I schools are schools with high numbers or high percentages of children from low-income families. Being able to access these schools and provide our services will greatly benefit the children of the local school and their family. Types of students that might be served by the Title I funds include migrant students, students with limited English proficiency, homeless students, students with disabilities, neglected students, delinquent students, at-risk student, or any students in need. The purpose of the Title I program is to improve curriculum, instructional activities, counseling, parental involvement, increase staff and program improvement. Knowing that dental decay can cause pain, infection, and problems with learning due to missed days of school, getting to these schools will be greatly beneficial to the students in need as well as to help with the Title I goal. Two different studies were utilized during the formation of this program. The first study's primary purpose was to study and evaluate methods for detection of monitoring occlusal surfaces through clear sealants. Results from the study suggest that occlusal surfaces without cavitation that are sealed with a clear sealant can be monitored over time. This may aid in prediction of need for sealant repair. This study benefits us because we will know that we need to reassess our sealants at 3 months and 6 months. The second study concluded that income modifies the association of parental education on sealant prevalence. Recognition of this relationship is important for health promotion efforts, especially when going to a Title I school. Smiles in Need Deserve Sealants Indeed will increase the amount of adolescents with one or more sealed permanent molar tooth in Title I high schools. We will first acquire proper funding, identify schools with students in the greatest amount of need, develop a plan to implement sealant and educate patients, implement the Title I school-based sealant program, and then evaluate for improvement and need for further programs. This program would best take place in local Title I high schools. The target population of this program is 13 to 15-year-old adolescents. We would be able to have access to student participants during the week while they are at school. The pros of this environment include the students within the age range needed will already be on location. Cons of this environment include student attendance, as well as the quick time limit per student in order to get them back into the classroom as soon as possible. The personnel needed in order to facilitate our agenda are a registered dental hygienist, dental hygiene students, and a dentist. We would also need help from a school front office coordinator to help with facilitating having the students available. For resources and funding, we'll have Medicaid and state children health insurance programs, Florida Department of Health, insurance companies or other local health agencies, community health centers, grant writing for nonprofit organizations, and sponsors. Our objective is to increase the proportion of adolescents aged 13 to 15 who have received dental sealants on one or more of their permanent teeth. There will be 2 to 3 days that will be on campus at the Title I high school providing oral hygiene instructions, doing our initial assessment, and applying sealants to the permanent virgin molars. The students would not need to leave school in order for this to happen. Student participants will be sent home with a consent form to be signed by a parent or legal guardian and turned in to their teacher prior to our arrival, and then a reassessment would be done at 3 and 6 months. Outcome goals are to increase the interventions and to decrease carious lesions in permanent molars. Two indexes will be utilized during this program. The DMFT for prevalence of caries determines the status of dental caries activity of decay, missing, or filled teeth of permanent dentition. We evaluate 28 teeth, excluding third molars, by clinically examining 5 surfaces of each tooth, the occlusal, lingual, facial, mesial, and distal surfaces. The next index will be the plaque-free score. This determines the location, numbers, and percentage of plaque-free areas of teeth. We record the number of surfaces of plaque marked by the applied disclosing solution. 6 months are required for the program implementation and for the successful assessment of change. 2 to 3 days during a school week will be needed for the initial assessment of plaque and decay, as well as application of the sealants, and then we will reassess at 3 and 6 months for prevalence of decay and success of the sealant. While implementing this program, it is important to keep in mind the 5-dimensional health model and make sure to provide positive input on all 5 dimensions, which are physical, emotional, mental, social, and spiritual. We will be able to provide a toothbrush and floss to our student participants, try to establish trust, increase their knowledge of dental health. Students will be able to interact with other student participants and hopefully improve their values of dental health. We will use a quantitative study design in order to collect data to evaluate the effect of the oral health education, home care instructions, and sealants on carious lesions prevention in adolescents aged 13 to 15 attending Title I high schools. Descriptive statistics will be given for our target population of 21.9%. They will include age, gender, race, socioeconomic status, brushing habits, and days in attendance of school. To display our data results, a bar graph will be used to demonstrate statistics of our student participants and a scattergram to show correlation between placing sealants and the amount of students without new carious lesions found at our reassessment. The null hypothesis would be no change in the caries rate of adolescents. The alternative hypothesis is that there will be a decrease in the amount of carious lesions among adolescents. The alpha level or p-value are set at 0.05 or 5%. The types of error that can occur are rejecting the null when it is correct, accepting the null if it is incorrect, or accepting the alternative if it is incorrect. The chart at the bottom of the screen shows type 1 and type 2 errors made when accepting or rejecting the null hypothesis.